Dear Chair and dear audience, I would like to present my PhD thesis, Innovative Multimodal Imaging Techniques in Dermatology. My name is Noémi Varga. I'm a medical doctor and a PhD student at the Department of Dermatology, Venerology and Dermato-Oncology, Semmelweis University. My supervisors are Norbert Kiss and Marta Medvec. Our vision is to improve the survival of skin tumor patients, and in order to achieve this vision, our mission is to promote the implementation of novel imaging techniques in clinical practice. We have two ongoing projects. Both of them are systematic review and meta-analysis. I would like to introduce my first project, that is comparing the efficacy of imaging modalities for the diagnosis of malignant melanoma. Malignant melanoma is a melanocytic tumor that is responsible for the most skin cancer-related death, with an estimated death rate of nearly 8,000 people every year. The main reason for low survival rate is delayed therapy, and that's why early diagnosis is crucial. So therefore, there is an unmet need to find new diagnostic techniques. Dermoscopy is the currently used gold standard non-invasive method for melanoma diagnosis. However, it has several drawbacks, such as it is examiner dependent and it has limited diagnostic reliability. Novel non-invasive optical diagnostic techniques use the special properties of photon and light to obtain more detailed and higher resolution images of the skin. Therefore, our aim is to compare the diagnostic accuracy of non-invasive optical diagnostic techniques for the detection of malignant melanoma. Our clinical question is, which is the most accurate non-invasive optical diagnostic tool for the detection of malignant melanoma? Here we use the paired framework, where P is the patients with suspected melanoma. The index tests are non-invasive optical diagnostic techniques. The reference standard is histology, and the diagnosis of interest is malignant melanoma. We planned to compare the index tests with the reference standard histology, and we also plan to compare all these non-invasive optical techniques with each other as well. Our hypothesis is that novel non-invasive optical diagnostic techniques have better diagnostic accuracy than conventional dermoscopy. Here you can see our final search key. We conducted our search in November, and on the right side you can see the flowchart of selection. We started with more than 16,000 articles, and at the end we had 141 eligible full text. This slide presents the results of random effects diagnostic meta-analysis, comparing the sensitivity and specificity results for each diagnostic method. The bivariate plot on the left side displays the sensitivity versus specificity for each imaging method, with different colors indicating different methods. This figure helps to visualize the diagnostic accuracy of each technique and the overlap between the techniques. On the right side, you can see a summarized table of the pooled sensitivity and specificity results of these diagnostic techniques, including the confidence intervals. The methods are ranked based on the sensitivity results. Overall, we can say that dermoscopy combined with artificial intelligence and reflectance confocal microscopy showed the highest sensitivity. However, their specificity slightly varied. Additionally to that, multispectral imaging combined with artificial intelligence also reached a very high sensitivity, and it also reached, interestingly, high specificity results. Conventional methods like dermoscopy and teledermoscopy showed a very strong performance, but they showed moderate sensitivity and specificity results, and pure multispectral imaging showed less sensitive and specificity. In addition to the previously mentioned 6 methods, we also investigated 3 other optical imaging methods, but due to the limited number of articles, we presented them on forest plots. The forest plots depict these 3 optical methods, sensitivity and specificity results: the dermatofluoroscopy, optical coherence tomography, and Raman spectroscopy. We can say that, based on the statistical analysis, dermatofluoroscopy reached the highest sensitivity out of these 3 imaging modalities. However, it reached the lowest specificity. Optical coherence tomography also showed a balanced performance with moderate sensitivity and specificity results, and Raman spectroscopy reached higher specificity than sensitivity, but both of the results were very, very low. To conclude, we ranked all the investigated imaging modalities based on the Uden index. The Uden index is a summary measure of the diagnostic accuracy of these imaging modalities, with higher values indicating better performance. Overall, we can say that integrating artificial intelligence with imaging techniques like multispectral imaging and dermatoscopy, it can significantly enhance the diagnostic accuracy of an imaging modality, particularly in terms of sensitivity. On the other hand, conventional methods like dermoscopy, optical coherence tomography, teledermoscopy, and Raman spectroscopy, they present a strong performance and they offer a balanced opportunity in terms of sensitivity and specificity, underscoring their reliability as a diagnostic technique. Also, reflectance confocal microscopy shows a high level of evidence, so it also underscores its reliability. At the end, Raman spectroscopy, multispectral imaging, and dermatofluoroscopy showed very low Uden index, so this can indicate that they may be less effective than the top performers. The strengths of our study lie in the large sample size, encompassing a large number of patients and lesions, facilitating a comprehensive analysis of these non-invasive optical techniques. The heterogeneity in the type of the studies and differences in testing strategies limited the systematic comparison of these techniques. In conclusion, we can say that dermoscopy still remains the most effective diagnostic tool for skin melanoma, and more objective and accurate detection of melanoma can be reached with the use of artificial intelligence. But overall, implementing these new techniques to the diagnosis of melanoma can improve the survival of melanoma patients. We are currently at the manuscript writing stage of our first project. And I would like to briefly introduce my second project, comparing the diagnostic accuracy of imaging techniques for assessing Breslow thickness in malignant melanoma. As I mentioned previously, melanoma is a very dangerous tumor, and early diagnosis and treatment can lead to a better survival for melanoma patients, so therefore early staging is a crucial point of melanoma care. The stage of the melanoma is primarily established based on the Breslow thickness. However, it is unavailable at the initial clinical diagnosis. The Breslow thickness, if we can accurately determine the thickness of a melanoma, we can define the required surgical safety margin, the stage of the melanoma, the need for the sentinel lymph node biopsy at the same time as primary surgery, and also it sets out further imaging procedures such as PET-CT and MRI. Therefore, we aim to compare the diagnostic accuracy of non-invasive diagnostic techniques for the preoperative prediction of Breslow thickness. Our clinical question is the same: which is the most accurate from these tools for the preoperative prediction of Breslow thickness? We also used here the paired framework, which is same as previously, with the difference that the diagnosis of interest is the overall diagnosis of Breslow thickness. We hypothesized that the diagnostic accuracy of non-invasive diagnostic techniques is non-inferior to the histological evaluation in the preoperative prediction of Breslow thickness. Our second project seems to be feasible, and we plan to submit both of our projects this year. And I would like to say thank you and goodbye with the quote of J.K. Rowling: "It is important to remember that we all have magic inside of us." Thank you for your attention.
So thank you for the nice presentation. I would like to ask a question regarding your first project. So the 9 optical imaging techniques that you showed, and I was wondering whether have you found any other diagnostic methods to diagnose melanoma?
Thank you for your question. Yes, we found 3 other optical imaging techniques, which we would like to include in the systematic review part of our project. We would like to include the multiphoton microscopy and multimodal spectral diagnosis, which combines the fluorescence, reflectance, and Raman spectroscopic methods. And also we would like to include a new one, which is a near-infrared and skin impedance spectroscopy.
Thank you.
Which methods are in the daily practice? Naturally, I know the dermoscopy and the dermatology, but from the other possibilities.
Yes, thank you for your question. And as far as I know, in Szeged, they use reflectance confocal microscopy. And in our clinic, there were investigation about the optical coherence tomography, but we carried the patients to the ophthalmology clinic to measure the patients with optical coherence tomography. And also, in our lab, we are investigating the multispectral imaging, but it's not in clinical practice. It's also in a study part. So I would say these, but yeah, mainly dermoscopy and teledermoscopy. Yes.
Regarding dermoscopy, the corresponding level of evidence was only moderate, and I would like to inquire about that. What is the reason behind?
Yes, thank you for your interesting question. As we could see that reflectance confocal microscopy reached a high level of evidence, and we expected that dermoscopy will also reach a high level of evidence which could actually base our result. But as far as I know and as far as I saw from the articles, the moderate result is because of, in the articles, they used different checklists for dermoscopy when they diagnose melanoma. For example, they used the 3-point checklist, 7-point checklist, A, B, C, D, E score, Menzies scoring, so different kind of checklists. And this can change the consistency of these articles. So in the grade assessment, we found, in case of dermoscopy, a high inconsistency, and it lowered the level of evidence for dermoscopy.
Okay, you mentioned, if I remember well, that the dermoscopy is the best diagnostic approach to prove the diagnosis of early melanoma. And anyway, the removal of early melanoma it's very crucial in the survival rate. But is there any data regarding the experience of using dermoscopy? So how long does it, for example, 5-year experience is needed to use the dermoscopy in the right way, or there was no any data about that?
Thank you for your question. Yes, actually, when I was reading the articles, there were several articles and several data on which they examined the different users of dermoscopy. There were specialists, there were oncologists, there were residents, and there were also articles which examined medical students using dermoscopy. And in the articles, it was significant that the specialists reached the highest sensitivity and specificity results. So I would suggest that there is also, this is also can be a good topic for a new meta-analysis. But I would say, yes, the articles were very consistent about this result. So a specialist can use better dermoscopy than a resident, for example.
Okay, thank you very much.